some development setting as well. CODA started 6 years ago, where the vision also evolved, but the vision is to move towards a digital public good. It is an easy, near real-time access to data for decision making. You are able to get individual data from the beneficiaries and track the status, health and nutrition status of children and pregnant, breastfeeding, and women and girls in real time. CODA was redeveloped to be open source and interoperable with other local health systems. This was last year with the redevelopment. And CODA also can go beyond nutrition programs and other individual assistance programs as well, which could be school feeding, social protection, any individual beneficiary management under health and social protection data space. So the value proposition of CODA, the reason why it was also started, that it reduces reliance on paper-based systems. And within UN agencies, you can also see that too much reliance on paper-based records impedes a lot of the data efficiencies as well. CODA was also developed to reduce any kind of errors and duplications and gaps in data as well through digitizing it. It gives targeted nutrition and health support to the beneficiaries in need. It is agnostic and links with other data systems. Currently, we are testing it out to link it with DHIS2. It is efficient nutrition data management as well. CODA has a strong aspect of efficiency and cost savings as well, where because you take away the reliance from paper-based records, it's able to save a lot of cost. And I will show you the example in the latest slide. CODA is also near real time. It's eco-friendly as well. You're not wasting a lot of paper, and then you're able to collaborate better on nutrition and health through working with partners, because CODA was co-designed and co-developed with the government, with essential partners in South Sudan as well. And as we move towards CODA being a digital public good, we want this to be in a way that all actors collaborate together and use one digital source. So this is how CODA works. CODA, the frontline workers, which are the healthcare workers at the field level, they collect data from the beneficiaries using the mobile application and the NFC cards. They can collect data offline, and once they reach any kind of health facility, they can connect it online, and that data is already synced in cloud and accessed on a web-based platform as well, where you are able to access real-time data on in a visualized forms on dashboards. The amount of information it's going to collect and what CODA can do, it registers a beneficiary, it collects anthropometric data, medical data, any kind of assistance they received in the form of food, cash, voucher. And then for me, the best part about CODA is that it serves as a job aid to health workers, where whatever is the status of a child or the beneficiary, and whatever that district programmatically is able to offer, it can automatically tell the health worker that this is the services they could receive. Like the child should be given specialized nutritious food, the child should be given XYZ. So, it is able to be a bit of a job aid for frontline workers, knowing that they're already overloaded with a lot of work. In terms of core programmatic areas, we are currently collecting health level data. It's able to address severe acute malnutrition, moderate acute malnutrition, SAM and MAM product base. It's also able to look at a moderate acute malnutrition alternatives. We're talking about vouchers, cash, local foods, and any kind of prevention of nutrition. Sorry, these are technical terms, but prevention means more of an integration of nutrition into other sectors like social protection, school feeding, and the ability to go beyond nutrition programs as well. These are some of the programmatic achievements CODA has had, right? So we're able to have better data, it's faster, it saves a big amount of time for healthcare workers to register a child. Earlier, it used to be 30 minutes. CODA reduces that time to 8 to 10 minutes. It's efficient, and it's also streamlines process as well, saves times, improves the productivity of healthcare workers. It saves the cost as well. There's a huge cost efficiency element because you're able to replace manual record keeping, and it's also the we've developed a strategy which is more of a sustainable expansion to different country offices as well. Last slide from my side, and I'll give the floor to my colleague Kasi, but this is a simulation that we've done in South Sudan where we saw that how much CODA was able to save the money. So if you look at the left-hand side, you will see that through manual record keeping, through using paper-based to record beneficiaries, WFP with partners was spending around $4 million per year. But when it was digitized, CODA was able to save the cost to, and country office was spending 2.5 million. So over the course of 5 years, CODA became more cost effective, saving about $1.5 million compared to manual record keeping as well. I'll give the floor to my colleague Kasi, who will walk you through some more technical details. Thanks.
Yes, so thank you for joining our breakout room. Just to say that the technology has ensured that why did we have to put CODA on this technology that we have? Because it's been redeveloped to be a more modular architecture. The software chosen ensures that it is system agnostic in an open source technology like Adira has mentioned. It is also hardware agnostic. And this reminds me of the very first version of CODA we developed. It was working only on a certain particular type of Android devices that were manufactured by a particular, it was tied to one device and a particular company. But we redeveloped it to make it more device agnostic. So any Android device with more than Android OS 8 and then maybe NFC technology can use CODA. It has the ability to be connected with other data systems and then other systems like the DHIS2, which is widely used by most governments as a health management information system tool, and also has the potential of being used because of the modular architecture and easy customizable data of the application. You can use it for any other program that involves individual case management. So yeah, next slide, please. So there are questions on our experiences regarding the driving force for developing CODA. I think Hajira has mentioned that in the roadmap to the problem statement and value proposition, right? But what is driving is the fact that there is a huge need for a digital solution for our nutrition and health space in humanitarian context, especially, and so there are so many challenges involved with the manual paper records that we are currently keeping, especially in terms of cost and loss of data, beneficiaries being lost to follow up, and our ability to really understand our programming, how we are our programming, why we are seeing the results that we see. So what we have done for the past few years is that we have finally achieved a product that is capable of being scaled rapidly and then scaled widely, irrespective of the context, as long as the conditions that are there to necessarily protect the beneficiaries that we serve exist. You can use CODA there. You don't need connectivity at all places because it works offline, and then the data just has to be sent online one time for us to also use the data to make sense. But at the front end, you can use the data any way that you want. And then, but we did see challenges, right? And these challenges basically, it's a technology. You need to charge phones. You need to charge. you need people to have that experience and then synchronize the data. But our experience is that there is weak IT infrastructure in the locations where we implement CODA, and this is one of the key challenges that we have. It doesn't limit the implementation of CODA, but it's certainly a challenge that we wish did not exist. So integration with national systems is also one key challenge because sometimes the national system is not also ready for this. Sometimes the government does not have the capacity itself for this to happen. So the uptake is something that we surely would want to be better, and we are seeing strong interest coming from various countries since CODA became ready. We are looking forward to a more human-centered design thinking approach to implementing and rolling out CODA with a more agile development process. So forming more strategic partnerships around the world, and then continue aligning the product to changing protocols and context. So basically, these are the key highlights of our solution that I would like to share. Next slide. So looking ahead, assurance of quality of services, assurance of accountability to the people that we serve as a humanitarian community has become very important to us because of the challenges associated with aid diversion, with whether beneficiaries are getting what they deserve. So CODA ensures or has the potential to ensure that we can know exactly which beneficiary is being served, where and when, and with what, right? So we have the ability to actually tell what our partners, cooperating partners, are actually being able to achieve, what the challenges are, and so on and so forth. We are looking at the fact that maybe if we can use CODA to ensure that people understand that the work they are doing is having impact. So this is my final slide, and the next would be any questions and comments.